Here's a patient where I was planning on doing counterpressure with a Q-tip, but it just wasn't working out with the patient. So I pretty much did it without counterpressure. You can see it's a little bit harder to get in without the counterpressure. Again, the bimatoprost implant adhered a little bit to the injector, and it's just a matter of rolling it around a little bit and just being patient, and it will come off. I have not had any adhere to the injection site. So as long as you're patient, you can leave that thing in there for a few seconds comfortably. This is a pseudophakic patient that had a MIGS procedure and cataract surgery for acute narrow angle closure. She presented with a pressure in the high 40s, and you can see the implant going in fairly smoothly, and that is ideal, and that happens most of the time. And I will often now use my finger to counter pressure, and you can go in 2 bevel lengths, and it's ideal. You can't always control. Sometimes you go a little bit. When I first started, I was going a little bit deeper. But 2 bevel lengths usually get you in there pretty smoothly. These are done at the slit lamp. You can do them supine as well. I don't use a speculum. I think the patients are much more comfortable that way. Here's a patient that was on 5 drops. I've been following for 20, 30 years. You can see she's had neurodectomy. She also had a lot of posterior pressure at the time of surgery. She's got a little iris atrophy at the wound, and she is now off 4 medications with the bimatoprost. So here's a patient, and some of them have a pretty good blink reflex or floppy lid, so it also depends upon who in your office is holding the lid. So be patient. Talk to the patient while you're doing this. Tell them just relax. We're going to hold your upper lid. And this one, I believe I did not even use, you can see I'm using counter pressure on the lid with my finger. And I have a pretty acute angle there, which I think is really preferable as far as insertion. You can't always get it that way, but you can see where it no matter what you do, sometimes that implant is going to want to adhere. And I just go back and forth a little bit, and it comes down like a little bit of a log tumbling down, and it finds its home somewhere between 5:30 and 6:30 almost always.